ensuring continuity of services even amidst lockdown and travel restrictions. I'm sure we all remember the lockdowns. Telemedicine in particular became sort of the lifeline for vulnerable population, offering access to medical consultations, diagnosis, and treatment from the safety of people's homes. The digital tools also played a vital role in disseminating accurate information about the virus. Everyone was curious at that point, what is going on? We all wanted to know. The debunking misinformation and promoting preventive measures. Through mobile app and social media campaigns, individuals gain access to real-time updates, guidelines, and resources empowering them to make informed decisions about their own health and as well as safety. Again, we can all agree that the pandemic further highlighted the long-standing challenge of equitable access to healthcare globally. Digital health tools have the potential to bridge this gap by providing marginalized communities with the same opportunities for care and information as their privileged counterparts. By leveraging mobile technology and community-based initiatives, digital health can reach individuals who may not have easy access to traditional healthcare facilities. While the journey towards digital health equity is not without its challenges, the potential benefits are immense. To fully unlock the potential of digital health, we must address the challenges of digital literacy, data privacy, and as well as cybersecurity, ensuring that these tools are accessible and used responsibly. Additionally, sustainable funding models are crucial to guarantee the long-term availability and scalability of digital health initiatives. As we move forward, collaboration between learning institutions like the University of Lagos, policymakers, healthcare providers, and private sector is imperative to create a holistic ecosystem that leverages digital health tools to build more resilient and equitable healthcare systems. By utilizing the power of technology and fostering collaboration between stakeholders, we can create a future where every Nigeria has access to the healthcare needed, regardless of the location and regardless of their socio-economic status. At the Federal Ministry of Health, we are embracing the potential through the Nigeria Digital in Health Initiative, NDHI, championed by the Honorable Minister of Health, Minister Tunji Alausa. This is an ambitious initiative, but is yet achievable, that seeks to create a unified and interoperable health information infrastructure underpinning a more equitable and efficient health system in Nigeria. Through initiatives like the NDHI, the Nigeria Digital Initiative, Nigeria is leading the way in creating a more equitable and efficient healthcare system. This includes making electronic records accessible, investing in digital health infrastructure, and building a stronger healthcare workforce, equipping healthcare workers with the skills they need to excel in the digital world of the 21st century. At the NDHI, there's a transition from paper-based records to electronic health record systems. With these advancements, individuals can take ownership finally of their health, having their health records regularly available in their pockets, on their mobile phones, empowering them to make informed decisions about their own care, allowing them to finally be part of their own health care. By providing standardized national EHR systems, we aim to empower healthcare workers with the tools they need to deliver better care, enhance data-driven decision-making, and streamline service delivery. This initiative is not merely about technology, it is about connecting healthcare facilities and also enabling seamless data exchange to improve access to quality care for all Nigerians, regardless of their location, and again, regardless of their socio-economic status. We must remain committed to the principles of equity, inclusivity, and sustainability, designing digital health solutions that cater to the diverse needs of our population, and ensuring that no one, and I say no one, is left behind. The NDHI recognizes the potential challenges ahead. We are not oblivious to this, but we must issues like infrastructure, data privacy, again, digital literacy, to ensure that technology acts as a catalyst for this positive change that we all desire. The NDHI is a testament to our commitment to harnessing power of digital technologies to improve health outcomes for all Nigerians. We are confident that these initiatives will play a pivotal role in advancing global health equity and creating a healthy future for generations yet to come. Now, I cannot end this address without acknowledging the University of Lagos, who has brought together influential stakeholders to tackle the complex challenges facing health service delivery and health equity. The University of Lagos is uniquely positioned to facilitate these essential dialogue. Its commitment to translating academic findings into practical solutions to foster meaningful exchanges between industry and academia encourages collaboration. This event underscores the vital role that an institution of higher learning can play in driving digital innovation, digital transformation, and overall promoting health equity. Today's event also provides a unique opportunity to engage in discussions that will delve deeper into themes and digital transformation and health equity. I encourage everyone to participate actively, please, as the insights shared will be useful in shaping our path forward in both academia and industry. Thank you once again for the honor of addressing you today. I look forward to insightful, engaging, and fruitful discussions from this very diverse audience. Thank you very much. God bless the University of Lagos, and God bless Nigeria. Thank you.
Another round of applause for Dr. Nike Ojewale, Senior Special Technical Advisor on Digital Health to the Minister for State for Health and Social Welfare, Dr. Tunji Alausa. Thank you very much for that very aptly delivered, address. Of course, we will be looking at other issues. We'll delve into that because we have a whole lot to actually touch today. I've been made to understand that we'll have the Minister representative sit here on this side of the table pending when we're done with this very first session so that he can share his thoughts further on what is delivered earlier. Alright, it's almost time for us to have our first panel session. I've been told we shall be looking at a very, very important aspect of global health. This time it's about improving the capacity of universities in global health research. And handling that for us will be Professor Omolola Orenuga. Please have a beautiful round of applause for Professor Orenuga. All right, Professor Omolola Orenuga will be joined on the podium by Professor Leila Mati from the European Union, Professor Abosede Afolabi, a Director at Swiss University of Lagos. A round of applause for them, please. Professor Francis Griffith from the University of Warwick, and we have Dr. Molatito Ayenigba, a Senior Specialist at the Breakthrough Action Nigeria, the USAID funded project. I've also been told that Dr. Molatito Ayenigba, Professor Francis Griffith and Professor Abosede Afolabi will be joining us online. You can watch us at UNILAG Nigeria on YouTube, and of course we have this event also being streamed via Zoom.
Good morning. Good morning. Good morning. Great Akokais. Vice Chancellor, Professor Olashade Tolulope-Obishola, DVC, Academic and Research, the DVC, Management Services, all other members of management, the Executive Secretary of Tech Fund, Dr. Sonny Echio. I hope I pronounced that well. The representative of the Honorable Minister of State for Health, Dr. Leke Odewale. My own brother, the former Provost College of Medicine and Director UNILAG, Professor Leshi. I welcome you to this panel discussion on global health. With me this morning to discuss the session on improving the capacity of universities in global health research. I have Professor Leila Makib from the European Union. She's the first secretary, and she was very instrumental. And she's an academician and researcher, information and technology science. I hope I got that right. And then in 2021, to be precise, she was an associate to the French Embassy, and during that period there was a donation made to University of Lagos, the fabrication lab. And you can imagine yesterday that we actually came first place and third place. That just shows you that the lab projects, the fabrication lab projects, has borne good fruits. And I pray that going forward, we'll have more and more donations in that light. I also have with me, joining me, thank you, a round of applause for Dr. Leila. And there are actually 4 powerful women on this session. Unfortunately, only one of them is present with us physically. The other 3 are joining online. And I want to crave your indulgence to ask the representative of the Honorable Minister of Health, Dr. Odewale, to join us briefly for the panel discussion. So I have Professor Bose Afolabi already online. She's with us, and she's a very busy woman, Director of CCTRIS. In fact, she's had to join in, she's busy within meetings and site visitations. So she's going to be with us briefly, but I hope that she will have enough time to spare us to honor this session as well. And I think I have, I can see Professor Frances should be somewhere there. Can you see her? Oh yeah. Thank you, Professor Frances, for joining us. So I'll just give you a brief about Dr. Bose. She's the Director of CCTRS, the Center for Clinical Trials, Research and Implementation Science. And the center has been transforming healthcare delivery and improving health outcomes locally and globally. She's a gynecologist with vast experience in administration and conduct of large clinical trials. And she's been very, very successful. And she has been, her team and her, she has been a beneficiary of very high net worth grants from the Tech Fund and from the Bill and Melinda Gates Foundation. And which is we're very proud of her as an alumnus of University of Lagos. I've just promoted you to University of Lagos. Yeah, one of us. Okay. So, without much ado, I think I'll just give you that for Frances now. Yes, she's online, and I have her on. So Frances is a professor of medicine at Warwick Medical School, University of Warwick, and she holds a research chair in South Africa, and she's she's also at the Center for Health Policy, University of Witwatersrand in South Africa. You're welcome, Frances. I'm not sure Dr. Aida is online yet, but she's a director. Dr. Ayeniba, I can can't see her yet. Okay, when Dr. UNILAG comes in, I'll take her profile. So I'll just sit back and then ask the questions. So now, okay, yeah. So we're basically going to be talking about global health and so my first question would you like to take the first question? Okay. So
do we depend on the question?
I remember the question. Okay, so I'll go with the first question. So you're all academicians, apart from the representative of the Honorable Minister. You're all women, and I'm so proud that I'm a woman today. You're all women, and you're all academicians, you're all clinicians, you're all researchers, and I think this is a good place to be in, and you all seem to have capacity. Okay, so now, talking about academics and industry development and research, how can academic and industry players co-create capacity building that improves community outcomes? I believe Professor Afolabi has done a lot in this area. Maybe you want to give us an insight from your own experience. Professor Afolabi, did you get the question?
Could you please repeat it? I didn't hear.
So how can academic and industry players co-create capacity building that improves community outcomes? Because I know I've had a look at some of the trials that you've been involved in, and it has a lot to do with improving lives.
Thank you so very much, and thank you for this invitation. I'm honored to have been invited to speak at this event, and I'm a member of the university, but unfortunately this particular time clashed with a pre-booked board and site meeting that I had. So I'm actually in Ogun State at the moment, and that's why I couldn't make it physically. I do apologize for that. But going forward, I mean, the question is a very urgent one in terms of town and down with the university liaising with the industry, with the community. Now, even though there's so many different ways, I mean, the immediate obvious one is funding. For example, the industry that has to do with healthcare, pharma, and a lot of other industries that are related definitely need to use research data to carry out their work. So the most obvious and immediate one is for them to identify appropriate researchers that can carry out the type of research that is necessary for them and fund. Of course, this sometimes become account for conflict issues, so that's part of why these days it's good to declare the conflicts of interest if you've been funded by industry. But apart from funding, which is the most obvious one, like I said, there's also capacity building between industry and academia. It's important for us to sit at the table to know what our expected strengths are. It's easy for us to just be in the ivory tower and come up with different ideas, but it's also good for us to see how these ideas can be useful in the industry, in the community, places where we're actually doing the research for. And one of the things with our center is that not only do we do the research trial, we also look at implementation science, because it's by carrying out, knowing how the research can affect the community and can be used in the community and the relevant industries. that you can actually, that research makes sense. It doesn't make sense for research to be done and kept on the shelf. So when you have your industry players as possible funders, as stakeholders who tell you what they need so that you can carry out the required work, and when you also do the research such that it can be used in the places where it's meant to be used and not just sit on the shelf. These are some of the ways in which industry and academia can collaborate to make things work better. So that's my first response to that question.
I'll still come back to you, Dr. Professor Falabi, because there's a follow-up to your response. Because I'm sure some people in the audience would like to know some of the challenges, and especially for young researchers, what type of hurdles they need to, come against. Yeah, I think I'll go to you, Leila, because you've been in university and had a lot of experience in collaborating with universities around. What do you think what are the roles of universities in providing research capacity to support access to technology that improves universal health coverage in Africa?
Okay. Yes, thank you very much for the question. In fact, it's true that universities, to my understanding, have a very crucial role to play in this, we were mentioning earlier, this talent gap kind of relationship. Universities should open more to community, but they're already doing it in Nigeria, but also provide support to work together with the private sector and build up some schemes to provide capacity building for health workers beyond what is being done currently. I explain further. We are as the European Union. We have what we call the global gateway strategy that I mentioned yesterday, which one of the five sectors is health. And health, we approach it as a global health approach. We adopted the global health strategy back in 2022, and so we are trying to build development strategy with our partners, including African Union, Nigeria, in order to bring together academia, research, and private sector into developing universal health coverage, local manufacture of vaccine and medical products. So we're trying to bring together both universities, private sector, and the nine ministries in charge of health. I just mentioned one program, maybe we'll explain later, but we do have one project which is called manufacture vaccines and medical products, which is a follow-up to the EU initiative on that topic after COVID. And we have an 18 million euro program that is going to be implemented in Nigeria. And it's focusing mostly on capacity building, working with research institutions, universities. We're working through NIPRIT, which is the Ministry of Health, in order to build the capacity for vaccine production in-house in Nigeria. But not only production. I mean, it's not only profs and researchers that we should help train. It's also all the supply chain, all the production chain, all the technicians. So that's some of the things that can be done together between university, line ministries, and the private sector. So we're also engaging a lot with the private sector in Nigeria. We have loans being given to companies such as Emzor in order to build up the local capacity. And those companies are supposed to be also working closely with academia. And that's the strategy that the Federal Minister of Health, Alipati, Honorable Alipati, really pretty much wants to set up. And he has been instrumental and very active, going around the world looking for support for this particular program. So that, I don't know if I answered your question, but that's the kind of things we can do.
Yeah? I think I'll go to Dr. Jewali now. I will not give you a direct question, but you see a lot of things have been said and your ministry has been indicated. I'm sure you have a lot to say as feedback. The last speaker actually roped you into so many of the things they're doing. So what's the policy, because when it comes to policy and implementation, the buck stops at your desk. So we want to hear from you. So, how you make things easier for us as we work together. Yeah.
So I don't know how I'm supposed to respond to that question. Or perhaps I should say that first, thank you very much for having me on this panel. And I just want to say very, very directly that Honorable Minister Pate, Professor Pate, and Honorable Minister Tunji Alausa, both ministers leading the ministry, the Federal Ministry of Health, are doing an amazing job to support not only industry, but also academia. And for all I care, whoever is ready to partner with them with the intention to move forward Nigeria as a whole, and as well to improve and drive our global national health outcomes. I'm going to touch upon the first question you asked, actually. I was quickly, as soon as you asked the question, I didn't think I was going to be on the panel. As soon as you asked the question, I was quickly...
And that's the question for Professor Folabi.
Yes, the question about
engaging
academia.
key players.
The question on academia and industry.
Okay, you want to give us your own...
Yeah, how they can sort of co-create capacity and move things forward. So I'll take a jab at that by just hitting on the data sharing piece. So academia and industry need to come together as far as data sharing is concerned. Right, the work is done in academia, they're doing the research, and then the data needs to transmit directly to industry and vice versa. There has to be open communication if we're going to really, really make an impact and drive up health outcomes. So those are my remarks. Thank you.
Thank you very much. I actually put you on the spot because we didn't have prior knowledge that we were going to be on this panel, and I do appreciate the fact that you've engaged us very well. Thank you so much. I think I'll come to Professor Francis before I go back to my dear sister, Professor Afolabi. So, Professor Francis, you've been at South Africa, you've been at Lori, am I correct?
Yes, I hold professorships at both the University of Witwatersrand and the University of Warwick.
Okay, so what are the sustainable frameworks for co-creating interventions that improve national health outcomes?
So I'm going to talk very much from the point of view of an academic working on the ground in universities. Obviously, universities have core roles in this respect. They are often involved in the training of health workers, so we do need to maintain ensure our curricula are up to date, and we train researchers, and we need a good pipeline of early career researchers that are able to undertake research in the field of digital health. There's lots of good models as to how to do it in Africa and beyond. So we could expand on that if we want to, but keeping that pipeline going is important. But when we come to specifically digital health, where there is some sort of technology involved, I have found over the years that industry and universities can take slightly different roles because they are coming from things in slightly different directions. And this can be of benefit. So in academia, we have the idea of academic freedom and being able to share ideas and create very new cutting-edge ideas. And we're good at that, whether it be physics or maths or whether we're in social science and behavioural sciences. When it comes to taking digital innovation into society or the health system, then often we need to do that with the commercial sector or industry. And understanding that there are different roles at different points from innovation through to implementation is useful. Some of my what I would call more technically based academic disciplines do the early stuff, coming up with the really new ideas. And then people like me who are more social science and impact focused will ensure that the trials are done, which one of my co-panel members mentioned, and that impact is understood and implementation is understood well. So we do have slightly different roles, which I think can be used for benefit. And the other thing that I found very useful to understand is that academics and entrepreneurs are often quite different people, and that we can benefit from that. So, for example, in my university, although all our undergraduates and postgraduates have the opportunity of undergoing training to become entrepreneurs and being able to set up their own businesses if they wish, there's also a recognition that academics are not always the best entrepreneurs. And so the universities need to provide considerable support for academics who have a really important idea that could go to market. They may not want to see it through, but the university needs to ensure that everything is in place to enable other people to take it to market and yet maintain some of the benefits back to the university. And also, I think universities have a role in doing the groundwork to build the relationships between individual academics and individual industry partners. My best experiences here have been where that groundwork has been done in a sort of central university capacity, and then I, as an academic, know that this industrial partner is someone that the university has sort of maybe checked out in some way, you could call it like that. And so that I can then confidently be an active partner with this industry partner, knowing that I'm doing that within a sort of envelope of security that the university has provided as far as IP and resources and sharing and all those sorts of things go. But I, as an individual academic, haven't had to do that. And that's where my really fruitful relationships with industry have started.
Thank you very much. Yeah, I'm coming back to you, Professor Folabi. I understand that a lot of your work has been in communities, rural areas, and all that. How, with the current situation, let's come back to the basics. How has it been reaching out to those areas? Yes, are you with me?
Yes, I can hear you.
Yes. Especially in terms of compliance, patients.
Okay. Thank you.
And monitoring.
Thank you very much.
Yeah.
So, a lot of our research work has been in primary health centers, and following up with women definitely has been challenging, especially in different parts of the country. So, for example, when we were in Kano at some point and we were recruiting women, we were finding out that getting their addresses was not very straightforward. So we had to get community trackers. So, generally flexibility is key. You have to get community trackers to be there when the women first get recruited and follow them home to know where their addresses were so that you can locate it around a particular landmark. So those are some of the challenges. Also, a lot of women don't have reproductive agency, as in control over their own, what happens with their own bodies and health as well. They have to get permission from their spouses, and for that reason we have to find a way of we have to include men in our organization and the research team, on-ground research team, to be able to speak to the male spouses and help ensure that they agree with the woman's decision to take part in the research. And then also other issues in the community include generally ensuring that women come back or agreeing to allow us go to their homes to follow them up. In fact, one of the projects we did, one of the exclusion criteria were women who were not going to stay in that community after delivery, because otherwise it would be difficult to follow them up. We wouldn't be able to travel to wherever they were traveling to. So research in communities definitely tend to be a bit challenging, but with flexibility and out-of-box thinking, you can always find a way to ensure that you follow the women up adequately. There was something said earlier about the arts industry thing and data sharing and all that. I think that's really a very important point for universities, especially universities in environments that aren't very conversant with that sort of innovation section. The University of Lagos has an innovation section, which is good in the research of. One of the things that needs to be made very clear, possibly put on our website, is how we can relate with industry. It's really important, because I've been in conversations with potential funders who have told me, okay, yes, it would be nice to support you in innovation, but how do we know what the ID sharing is going to be like? Is your university open to being a partner? They are funded, they're not charitable people at the end of the day. They're entrepreneurs who want to make their own money. So if they're going to support you, they need to know how the sharing data, ID, and sharing formula generally is going to be. So I just answered two different questions, but I want to bring that in.
But I was just also wondering if we're talking about we're in the innovation state now, we're talking about AI and all that. Do you think, how will that have influenced or improved your patient-reported outcomes, and you being able to reach the areas that really
difficult to reach? It's a good point, and perhaps this is one of the ways where we have to start thinking, outwardly. So there is a registry that one of my organizations, a non-profit, is doing, where we're registering vulnerable pregnant women, and we're reaching out to them, putting them on a database, linking them to primary health centers to make sure they come there for their antenatal care, and also deliver there so as to deliver safely, because we know that we have a very high degree of maternal deaths, and often it's because women deliver at home or with traditional attendants as opposed to skilled healthcare. So we've been looking at the logistics, and we know that we are hiring community health workers to follow up these women, and it's making a difference, but it's expensive. So if we can find another way in which we can use AI to reach out these women by the phone, for example, and also keep in touch with them, ensure that they come for these follow-ups in the hospital and get delivered safely, is definitely a way to go. And I don't think there's anything we can't do with AI if we put our mind to it. So it's definitely worth looking into that area.
Thank you very much. I think my next question, maybe it's going to be the last. I think time is running out. Between Frances and Leila, I think Frances mentioned something about academicians are not usually the best entrepreneurs, and I think in medical school, a lot of us you just usually you're just focused on giving your best as a humanity, service to humanity, and then on the Hippocratic oath. So it's not about making money, but money is very, very important. So in this day and age of technology, what do you think we can do differently, especially with our curriculum and with innovation, to actually make sure that academicians, clinicians, and researchers are on board? Because right now the problem we have in our country is that a lot of the health providers, health professionals, whether you're a medical doctor or dentist, nurses, we seem to be having a vacuum. And in the next 10 years, I don't know what's going to happen in this country. But now there's a lot being done. We have telemedicine, teledentistry. What do you think we could do differently in terms of our curriculum and in terms of digitalization of our healthcare systems?
So health workers of all types might become entrepreneurs. I don't want to say they can't be, and academics. But on the whole, as you say, we haven't gone into our professions because that's what we want to do, specifically. What universities can do is think right from the very beginning of training. Where are we introducing in our curriculum the whole issue of digital health and how it all works? And this is a global issue. So I include my University of Warwick in the UK as well as other universities in this, that we haven't perhaps done this thoroughly enough. But at every point in the, let's for example say a medical student's training, they should be considering what the digital options are at every point, because there are so many points where there is some sort of digital technology, however simple or complex, that might be used, and they need to understand not necessarily how to design and make it, but at least what's going on behind it. So, for example, I teach medical students the basics of the concept of AI so that they understand how to work alongside it. Then of course, researchers need the skills to undertake research related to digital health. Often those are more transferable skills because digital intervention is an intervention that needs trialing, evaluating the same way as any other intervention. And then support, as I've mentioned before, the support for those who do come up with innovations, so that the university benefits as well as wider society and the companies involved.
Yes, well, I come at it from a different angle, slightly different angle. Yes, we could do things on the curriculum, definitely. Yes, of course, when you go into health studies, let's say, not only medical studies, you're not necessarily looking at, you want to serve the people, you're not necessarily looking at making money, but it's good when the two combine, yes? So I think maybe, apart from maybe changing things to the curricula, is changing the mindset, maybe open up the doors of universities to innovators, to engaging the private sector, startups. You have lots of very bright and talented students everywhere in Nigeria, of course, especially the University of Lagos. That's where I am here today. But they don't remain necessarily have the right access to the right tools or the right fora, or the right the spark that is going to help them design their own projects. So I was visiting this morning the Fab Lab that you were mentioning earlier, and of course there was no health students there, but the students come up with so many great ideas every month, I guess. Those that go and use that open access space. So that's a space, it's open to all the people that want to, all students, all staff that have ideas and want to experiment and do something with it. To come back to medical, to health issues, digital health is a tool, but it's going to make a tremendous change in the way we do things. And I remember some years ago, still like when you do call for projects from students, they come up with so many ideas. I remember one from OAU, sorry it was not UNILAG, but who designs a referral system that would, allow primary healthcare center to send the information about the patient to the secondary, whoever, to secondary or tertiary, to the next step, so that the health system in a given state will keep track of the patient. Of course, so he designed the app, it was a tremendous app, but of course, primary healthcare centers, whether it's in Oyo or Oshun or Lagos, maybe Lagos is better connected, but they don't have electricity, so there is no chance for them to have little chance for them to have data. So the first challenge is equipping the primary healthcare center, and I think that's one of the challenges the ministry is trying to tackle right now. But you have lots of people with lots of ideas. And in fact, it's just, of course, we're going to support digital health with the ministry. I don't know yet on what, we need to discuss, but because it's a regional program that is trying to tackle lots of different things, so we need to see what Nigeria wants us to be focusing on. And we're not the only donors doing that, but it's just for universities. You have the youth here is vibrant. Students are great. We must give them space for them to develop ideas. And I finished on this, one of the things we can organize, is never enough, is those innovation days where you bring academia and startups and businesses in general, so that people that have bright ideas may meet with people that have the money or the know-how in how to set up companies.
And the people that have the policy. So I think we'll end with Dr. Nyewale, because at the end of the day, it has to do with policy and government.
Thank you very much. So I think I'm going to approach that question slightly differently.
No, it's not a question.
Oh, okay. Can I quickly make a remark?
Oh, sure.
Yeah. So, speaking about how do we ensure that the curriculum, some question about the curriculum. I wanted to quickly talk about that. So during my speech earlier, I spoke about COVID-19, how despite the fact that COVID was damaging, it also brought about like the mind, the innovative mind of everyone. Humanity sort of united to fight a common problem and beyond. So I do not see a lot of that yet as far as the curriculum of universities are concerned in terms of innovation. So to answer your question directly, what I would expect or what I would hope for in the coming future is to sort of like interdisciplinary collaboration. Even prior to talking to private sector, to talking to the industry, even within the university, can some of these departments, public health, medicine, social sciences, technology, can they come together, in a hub and do something together? And when I walked into the university last night, I brought memories of when I was in school myself, and I remember that medical students only spoke to medical students. It's about touching. Tech students only spoke to tech students. And in fact, medical students were so proud. All of us, you felt like you were the best in school at that point. But now we are at a point where we need a certain. I'm not gonna make it. It's time that faculties and departments, the interdisciplinary collaborations, we need to nurture that and encourage the students to be better. I think that's my closing remark.
Thank you very, very much. Thank you to my panelists. Thank you so much for your comments and responses. And I think the bottom line is we need more of interdepartmental collaboration, because there's so much we can do together. Science students, technology students, coming to medical students, we can create a lot of things. We can make our own drugs, we can make our own medical devices. There's so much we can do. We can do the apps to monitor our patients, to monitor what's happening to our patients. We can improve health so many ways by harnessing what we have and doing it right. Thank you so much, everyone.
Another beautiful round of applause for our panelists. That was a very, very well orchestrated panel session by Professor Mobelala Oremuga, who actually led that panel session so well. I'm sure there's a whole lot to take note to ponder on as we hope to improve the capacity of universities in global health research. All right. We know that we have a lot of activities on campus this very day. Since the titularities descended yesterday morning, we have the 17th University of Lagos Research and annual conference also open at this time, and I've been reliably informed that the conference poster session George's is about to start. So I want to inform members who are here to come, witness some of the takeaways, the thoughts that have been delivered by several panelists, to make their way they have to as the conference poster session for the University of Lagos 17th annual conference is about to start. I think on the hour of 12, that starts. Thank you very much. All right, in the meantime, I want to especially appreciate all the members of the university that are here present. When we started this morning, we had dignitaries and senior members of the university joining, to be a part of that session that just gone by. And we have in our midst the university librarian, Professor Yetunde Zai, amongst us here. A round of applause here. Thank you very much, Professor. We also have here in particular order the active registrar secretary council of the University of Lagos. This is Olamide Esther Makinde. Welcome. Thank you very much for coming. The second session is about to start, and this time we shall be taking a look at the academic and industry partnership in value creation for global health equity. And that session will be anchored by a member of staff of this great citadel, Dr. Noimot Balogun. I would like to make welcome to this very part of the hall some of the members of the panelists that will be joining to discuss further on that particular topic. In In no particular order, please let me welcome a former provost of the College of Medicine and currently the director of UNILAG University of Lagos. It's a creative place for those in the medical field, for us to create inventions that will advance, the medicine. Please may welcome Professor Afolabi Leshi. A round of applause for him. Thank you very much. We also have in our midst here quite early, and we're quite glad to have her all the way, We also have here in our midst Dr. Olufunke Fashawe, who is the Vice President of the Clinton Health Access Initiative. You can as well call them SHI. Welcome, my brother. We also have here Dr. Ni Oshamilui, is the convener of the African Digital Health Summit. A round of applause for him to welcome. We have Dr. Maurice Atoki, the Chief Executive Officer of African Business Coalition on Health. Please, a round of applause for her. I did say earlier that we have some dignitaries in the house, and we mentioned, please permit me to use this particular moment to appreciate our very former Dean of the Faculty of Dental Sciences, Professor Oyinkosola Shufola. You're welcome, ma'am. Thank you very much, ma'am. All right, Dr. Nemo Balogun, over to you, ma'am. A round of applause for Dr. Nemo Balogun. She is taking us through this session.
Good morning, ladies and gentlemen, all protocols duly observed. So, thanks so much for joining us here. Let me begin by saying Dr. Jalabi has gone, but then the era where you had medical students not interacting with people is going and fading away in the University of Lagos. I have my background in health sciences. I finished as a dental surgeon, and I am doing my PhD in communication at the University of Lagos. So, right now, before we start, let me quickly just read the short bio of the people that we have here. We're going to be having discussions around, academic and industry collaborations. And it's good for us to have an idea of where each and every one is coming from. So, starting from Dr. Let me start with my because I still doing my PhD, I want to pass. So we have Professor Leshi, he's the director of the University of Health Translation. He's a professor of pediatrics at the College of Medicine, University of Lagos, and consultant pediatrician at the Lagos University Teaching Hospital. His area of interest is pediatric neurology and neurodevelopmental problems. Professor Leshi is a member of several local and international associations. He's a foundation fellow of the American Academy of Medicine and the Academy of Medicine Specialists. A round of applause for him. Please, a round of applause. The only female in the group, we have Dr. Olufunke Fashawe. Dr. Olufunke Fashawe is the Global Vice President of Inspiration at the Clinton Health Access Initiative, SHI, and the Senior Director of Programs and Lead for the Sexual Reproductive Maternal Newborn and Child Health Portfolio of Programs in Nigerian office. She has over 10 years experience in global health, working on policy development, program design and planning, implementation, grant management at the country level. Before joining CHI, she was a health economics consultant at the Joint United Nations Program in Geneva. She started a global health career as an intern at the World Health Organization headquarters in Geneva. Olufunke is a bachelor in dental surgery. She was my classmate. A round of applause. From the University of Lagos, a master's in health management, economics and policy, and she has a professional leadership certificate from the Graduate School of Business, Stanford University. A round of applause, please. And the last but not the least, we have Dr. Tunji Alausa, who is the founder and CEO of Premier Health Systems, a public health consulting firm with vast experience in designing and implementing development programs. Is a convener of the annual African Digital Health Summit, a premier event that brings together thought leaders and innovators to explore the transformative potential of digital health in improving healthcare delivery across the continent. Additionally, Dr. Lee owns the famous UNILAG, Africa's largest online network of physicians. A round of applause, please. We are talking to innovators here. And he also serves as the chairman of the Medical and Pharmaceutical Group at the Lagos Chamber of Commerce and Industry. Once again, my own name is Dr. Raymond Abisola Balogun, and I'll be the moderator for this event. Thank you. Yes. So we begin. You've listened to Dr. Delaby. You've listened to Dr. Delaby talking about the need for collaboration. We've listened to the nations. Now this is a point of that coordination between the academic and industry players. So I want to ask first, how do we see the role of digital transformation in reducing global health inequalities?
Of course, which is when you talk about people accessing, being able to access care, irrespective of their socioeconomic status, irrespective of where they live. The way I like to see it is, what are the pathways to achieve health equity? One of the pathways I think is universal health coverage. Because the universal health coverage, then potentially we can achieve health equity. It's one of the pathways we do so. Then how, if we think about the little bit, how can we leverage technology to accelerate or catalyze achievement of universal health coverage? Because everybody can access health care without having to pay out of pocket, without fear of being impoverished, potentially we can use inequities in health care. And I see maybe two ways where digital transformation can contribute to accelerating achievement of universal health coverage. Generally, one of us is healthcare service delivery. Technology can help improving access to healthcare, the provision of those services, whether it's making it more affordable, whether it's improving the quality, and of course, like I said, access. Technology has the potential to increase or improve healthcare service delivery. But beyond just the service delivery, technology can also potentially improve patient outcomes. When you talk about clinical decision support systems and things like that. But of course, why we talk about technology? Because it's easy just getting technology for the buzzword. Everybody, we're innovating, the buzzword is digital transformation, AI, machine learning, and things like that. I always like to talk about 3 P's when we talk about that. What does it mean for us when we talk about technology? Is it just a buzzword? And the things are the patient. What can technology do for the patient? Again, we're talking about health equity. For a patient, technology can potentially lead to continuum of care, continue access in terms of you can go to like bankless banking, you can do GT from any branch. Once you open a bank, an account in any branch, you can walk into any branch. Let's imagine that for hospitals, so that any patient can go into any hospital and there's continuity of care for that patient. Technology can achieve that.
Thank you so much. Funke, let me come to you. TAI has done a whole lot in Nigeria, Africa, in the area of immunization, digital health. I know some of this personally. What is that thing that excites you about digital health when it comes to global health?
Thanks very much. So just building on what Dr. Lee started talking about, I think obviously everything around increasing access to services is really important. So I would like to look at it from a different dimension that people don't often talk about, which is how digital health, digital transformation can actually help to democratize a lot of things, right? So it helps, one, democratize communication. And when I did health economics, one of the things we talked about was the asymmetry of information between doctors and patients, where doctors would have a wrong moral incentive to drive unnecessary care because they had more information than the patients. The beauty of digital health now is people can pretty much access information, they can get educated, you can enhance patient literacy, right? So patients are more empowered, they know more about their healthcare. I think secondly, it can democratize data. When we were in school 20 plus years ago, the data was pretty much archived with a small group of people in those days. You had to go to the library, you had to search. But today you can ask ChatGPT, you can ask all sorts of software now, and the data is right there. Thousands, millions of data. Now what that does is, again, irrespective of where you are on the planet, you have access to that data, and that data you can use it in several ways, right? To again build yourself, empower your community. And I think the last thing is digital health can also create new economies for health. Healthcare is an industry that is untapped in terms of the potential. And there's so many opportunities. You talk about doing a PhD in healthcare communication. I mean, now that's fancy because of social media and so many platforms, right? Maybe 30 years ago, what was healthcare communication? So these are just some things that excite me, in addition to some of the examples that Dr. Liu gave. Thank you.
Thank you so much. So, like she said, healthcare is going to possibly determine the new economy, and there's a need for us to be able to kind of like foster collaboration and the ways think of new design thinking of working together. Professor Leshisa, what is the University of Lagos Global Health Institute? What does it hope to do in ensuring that it owns an academic relevance in the discussion of global health in Nigeria and by extension Africa?
So thank you very much. Just before I answer that, I just wanted to add something on what has been said. I think one of the great inequities in health is the distribution of health workers. And there are a number of projects that are leveraging technology to upscaling health workers remotely. And I'm sure you've heard of the ECHO project, where health workers are remotely trained to upskill them on various aspects of diagnosis of hepatitis and a few other things like that. So I think digital transformation clearly will help improve outcomes, because when patients remotely can access skilled health workers to make correct diagnosis and early referral, I think the outcomes would be improved. Now to your question of what University of Lagos is doing, I think one of the things, again, to pick on something Leila mentioned about, I think it was Leila that mentioned about developing an app and people couldn't use it because of power. One of the things that our students are doing at the University of Lagos is developing a fridge that doesn't require electricity, so vaccines. And I think we need to leverage on alternative sources of energy in improving, to support data infrastructure and improving access to information. And I think one thing, so in terms of university, we have a number of centers of excellence who are doing excellent work. And the Institute of Global Health was created to try and coordinate some of these things that across disciplines and faculties and expertise to be able to address specific global health problems. One example I can give, we have a design studio, and our students have come up with simple technologies addressing neonatal jaundice. Neonatal jaundice is one of the things that conditions where babies are born and they have jaundice and they can damage their brain. They have come up with this very innovative way of reducing and treating that problem. And then talking to companies in Holland to see if they can take it to markets and improve the outcome of babies born with neonatal jaundice. And I think those are the things that we have been doing in the institutes, coordinating other institutes and centers of excellence, doing innovative work, and trying to link them up with partners and collaborators.
Thank you very much, sir. I'm surprised that these three students were not part of the innovation challenge yesterday. We are hoping that for International Week 2025, we will see many more College of Medicine students. I mean, do not let them just do all
They're not College of Medicine students, actually.
Okay.
They're students of engineering, systems engineering, mechanical engineering, and all kinds of students, including medical students as well.
Okay, so thank you so much for giving us that insight. Okay, please let me come to you. As a global leader that finished from the University of Lagos, you just listened to Professor Leshi. And it means that we're beginning to have the goodwill, the will to bring students together across, across departments and all of that. How do you think that these alumni that are now global leaders like you, can begin to become mentors to these different centers and institutes, maybe through adjuncts, What do you think are the opportunities in this? So that Professor Leshi can hear now, and we can begin to start the policy with Dr. Jeremy.
All right, thanks, Naimos. I think the first thing is, to be honest, we need to know more what schools are doing, right? A lot of the academic institutions in Nigeria, we don't market ourselves. If you look at what developed countries do, in the US, a lot of the universities, schools of public health, they have sort of their own non-profit arms that apply for funding. It's a very big industry there. I think that's something we should do more of in Nigeria. To be honest, I didn't even know we had a Global Health Institute, as ignorant as that sounds. I knew about CC3 because of you, and because of the partnership with Dr. Apolabi's work. Right, so I think just raising the awareness would be a starting point. Do we have business development teams that reach out? So first of all, map all these NGOs, development partners, be proactive, I think the second thing is being really clear sort of what the vision, mission, and what I'm trying to achieve. We can't solve all the problems, but it's always nice to have a clear mission statement. I have a website that people can Google, read more, see your projects. We're talking about digitization, right? So let's leverage digital technology. Thirdly, I think we should tap into our alumni network, really. I'm really honored to be here. I thank Professor Rediga for considering me and inviting me. I've never been invited for this kind of conversation, and that's fine, but I think there are many more people like myself doing so many things out there that if we knew about these opportunities would be willing to participate. There are also opportunities for capacity building. A lot of our organizations, we organize training programs for staff, but most times you'll find us paying thousands of dollars for our staff to take health management courses at Harvard, at Stanford, whereas a Global Health Institute, UNILAG, could develop a customized suite of programs that our NGOs can leverage, right? So just like we have Lagos Business School, a lot of corporate organizations use Lagos Business School. Why can't we have something similar? It would be, I think that's one way. And then finally, on the capacity building side, we can offer internships, volunteers. I started as an intern. I went to the WHO as an intern. It was expensive, it was unpaid, now they are paid. But that was really what kind of gave me the exposure and the opportunity to build my career. And I would gladly give such opportunities to other students, right? So I think if our schools can, again, be more intentional and create these partnerships with NGOs, we will take interns, we will take volunteers. Last but not the least is on joint research collaborations. So, for example, we heard about the student from IFE who developed a referral app. For goodness sake, I spent half of my career, like my work, dealing with referrals, improving maternal newborn health. I would love to meet this student, learn more about the app, see how we can build an intervention based on this app, get funding and scale, right? So I think we need to do more research between academia, policy development partners. We come with resources, you come with the brains, we co-create solutions, you test them, you pilot them, and then we can take them to scale.
Thank you so much. Tunji has said a number of things, but co-creation, yes, around about what she tells us. Co-creation is a big deal. I mean, I I happen to be one of the recipients of the co-creation of where I spent 18 months. And if there is anything I think of health now and value proposition, I let it assist you. And I know that when we talk about innovation, we just have to be more intentional in bringing the academics and the industry players together. And it's just not on paper. I wanted to say, Dr. Jewale, did I get it right? I'm so sorry. Okay, so I wanted to say that because we also have someone from the federal government here, this is like a venue for us to begin this discussion. I hope that by the time we're done, Professor Leslie is going to have more discussions with Dr. Lee, with Dr. J, because we just need to be able to look back in the next 1 year and say, in the last 12 months, these are the things that we achieved in person, in terms of results, in terms of data. Thank you so much. A round of applause to all my panelists. Dr. Lee, as we speak, runs one of, if not the biggest, African digital conference in Africa that I know of. Dr. Lee, you've had some years of this discussion. How do you think that we can begin to bring in academic partners, create relevance? Forget about data. When it comes to data, when it comes to research, nobody does it well like academic partners. This is what they do. This is why they did PhD. How do you think we can begin to have a new dispensation, a new transformation right from here? Professor Leslie is here, our professors are here. What can be done differently at your own digital conference next year?
Thank you once again, Dr. Balogun. So I'll come to EHS. But 2 or 3 things that I wanted to say regarding academia. There's so much going on in Nigeria. So maybe 10 years ago, we talked about digital health, technology, health. People will say, what are you saying? But it's now, there's so much interest in technology. Because Dr. Fashawe is actively involved in that, in Lagos and beyond. And of course, Dr. Ojewale, at the federal level, there's so many things going on in Nigeria Digital Health Initiative. Lagos, most of the general hospitals, most right now have an EMR. There's some FMC, lieutenant and things like that. But now we're getting there. There's the need now to start thinking about digital health literacy. We need something like a digital health academy. And that's where I think institutions like UNILAG come. So we moved from 5-10 years ago where you will say EMR, people will say, what are you saying? It's now like, okay, EMR, I have it, or I'm going to. It's not like a new thing now. So we need to now start having that conversation about capacity building, digital health literacy. Do we need a digital academy? And of course, do we need to, in Nigeria, I'm not sure there's any center that does anything like diploma in digital health or masters in digital health and things like that. Even for maybe people like healthcare workers, we need to start thinking about capacity building now. And we talked about unlocking the healthcare value chain. That's something incredible that is not done at the federal level, because all that the Honorable Minister of State for Health is trying to do is to unlock healthcare value chain, and a lot of people can profit private sector. So I'll come back to ADHS. So of course, we're grateful to how we've grown at ADHS. Dr. Fashawe is one of our supporters, key. Yeah, and of course, you are also been a facilitator, moderator of a couple of sessions. When Professor Elena talked about innovations and bringing people together, it brings to mind a number of things that we've done and want to continue to do. Last year in ADHS, this year, it now seems like a really long time, but last year, okay, 2023, we had about 20 countries across Africa for ADHS. Now, this year, it was about 35 different countries. So we have some Iraq.
Round of applause, please. 35 countries.
Thank you. So the idea is, let's say something that I found out.
So in this global, sorry for interrupting, how do you think that the Global Health Institute, starting from the University of Lagos, I mean we are here, how do you think we can begin to work with people like you to ensure that that digital literacy, the digital center, the data, how can you begin to use academic partners to get some of those insights?
I think ADHS has become like a melting point. We have people from Iraq saying that we really come far. You know, but even though we think we're behind, you will see the interesting things that we're doing in Nigeria. So I think it will be great. Maybe next year, 2025, having, I hear about the design studio, yeah? Is it possible to have some innovations from there, using that platform to showcase some of this innovation, and to surface some of the interesting things that are being done, that have been incubated here? Can we use that platform to showcase them? We have Honorable Minister of State for Health, he actually declared open this year's event, and I think that's an incredible platform to be able to show the interesting things so that off-takers and funders like this can see that and see the interesting things that are going on. So I think ADHS, being what it is now, can serve as a melting pot to showcase innovations in digital health, and where we have the funders on one side, the policymakers on one side, and eventually with the goal of trying to take some of these innovations to scale.
Yes, the position of leverage. If you remember the way fintech started, for every innovation in fintech is based on the banks, and as such, you can have like a very seamless kind of engagement and innovation. Professor Leshi, a number of things have been said. Dr. Fashawe said a number of things. Dr. Osambui, how do you? I'm sure you're thinking of what do you think is the future for global health institutes in University of Lagos based on some of the things that you've mentioned?
So thank you very much. I think the future we have to leverage on collaboration and partnerships. A lot has been said here, and I think one of the things we are trying to do is build as many partners, build relationships with as many partners as possible across different fields. And I really appreciate the partnership we have with existing universities like Warwick, Loughborough, and a number of Kansas, and a number of universities, both in America and in Europe. But I think what we need to do is actually have more industry partners. And I think that's very important, especially partners who are in the field. Like
and are working locally.
Exactly. And I think one thing that comes up immediately from, I'm an academic and I'm a teacher. One thing that needs to change is clearly our curriculum. One of the criticisms of the medical curriculum, it tends to overload students. And this is across, I'm not talking of medicine specifically, I'm talking across all our health professions. We tend to load them with a lot of information. But unfortunately, this is one thing that is important and relevant that we need to add. We need to take something away to make sure that we learn this. Secondly, one of the objectives of the Global Health Institute is to run short courses. And clearly, a diploma to a master's to a PhD in digital health is clearly something that is necessary and immediate. And we start building capacity for that. And we're identifying young researchers to attend workshops which we are getting sponsorship for on various aspects of global health, including digital health. So I think we're looking forward to having that pool of people who will be master trainers in future. And I really look forward to the partnership with the industry and with NGOs, those powerful NGOs like Child.
Thank you so much, sir. Actually, when it comes to globalization, I think, yes, there are global goals, but when we're able to use our local actions to achieve global goals, it's much more sustainable. And based on this, I think we've spent a long time here. I want us to be able to have the last part of it. So can you just give a summary of what you think the future of work is when it comes to the universities and the industry players? What do you think, what's that future that you see in terms of global health and digital health? Starting with you, Fuke, as a way of rounding up. Thank you.
Sure, thank you. I think, going by what Professor Leshi has said, if we're more deliberate and intentional with collaborating more across the divide, so not just academia to academia, but really being deliberate, academia, development, and government. One of the things that I hope will be happening in the next few years is seeing better translation of evidence into policy. We tend to borrow a lot from research from outside our context, and then we try to tailor them to our context.
there's a huge gap in terms of local research from Nigeria, right? So I hope that through more collaboration, our universities can really start to do more research, and then partners like us can help to translate those into concepts that then get funded, that are tested at scale, and then people like Dr. Jawali and the ministers can then be influenced based on the evidence from that research to say, look, this is how you solve maternal mortality in Nigeria. We have the data, we have the impact, and so on. So that's what I'm excited about, and I hope will be the future of an improved partnership between academia and the development sector.
Thank you very much. Dr. Samli.
I think key thing, like I said, and I would also echo is collaboration, partnerships, of course, leading to research. Like I said, now we can begin to, we always talk about the promise of digital health. We've been saying it for years. But now digital health is being deployed. So it would be nice to know what is the impact of this digital health, like maybe in our general hospitals and the primary health care center. So what research are we doing to evaluate the impact? Because before it was potential. Yes, there's a lot of potential, but even the deployments, the implementation that are on ground, it would be nice for industry, development partners, NGOs, and of course academia to work together and see how we can actually provide evidence of further scaling of these interventions.
Thank you so much. Ladies and gentlemen, in the last 40, oh sir, sorry sir.
Yes, just to
no problem at all.
Last word here. I think one thing that is obvious, and this is based on what I've heard this morning, clearly we need to put our research out there. There's a lot that is happening in our universities.
Exactly.
I know that because I'm inside the university, I see it. But because it's not being seen or heard or known about, it doesn't exist.
Whatever is not seen is assumed not to be done.
So I think the challenge for me, what I see, is to get our universities, because even government does not even see it.
Yes.
Unless we are fortunate to have one of us in government. It shouldn't be like that. They should see it. They should go to the university website, go to the Global Health Institute website, see what is happening, see the exciting ideas, even those that are still being incubated. Because you know how academics are, when ideas are still being incubated, you don't want to publicize it. Otherwise someone might steal it. But those that have gone to the end and is ready for publicity, we should be out there. It shouldn't be heard by chance. And second thing that I think is a takeaway for me is that I think we need to develop courses that are meaningful and relevant to industry and to policymakers.
Developing courses that are meaningful and relevant. Ladies and gentlemen, it's been 40-50 minutes of engagement. We've been able to talk about the need for collaboration, the need for co-creation, the need for research, joint research, and the need for us to be able to think outside the box in ensuring that, yes, there are global goals, but there's a need for us to have the localization of these goals. In this hall, we have representatives from the European Union, we have representatives from the Federal Ministry, we have representatives from industry and academic. I think that the time for more discussions begins from here. The people that are going to start are here, and our time is now. Thank you so much for having me here.
You have the floor. You have the floor. Going 3, 2, 1, action. One more, last one. Thank you. Hold on. One of these. Boss, I beg. Bro.
Okay. Sweet. Cool. Perfect.
Alright, we're going to 3, 2, 1, action. One more. Last one. Thank you.
Another beautiful round of applause for our panelists, led by moderator Dr. Raymond Balogun. There's so much to take in from. I understand very much that there are questions. Yes. All right, that was well done by Dr. Raymond Balogun. You can totally understand that. When she says she's a medical doctor and that she has since veered into looking at an area to help amplify whatever it is they're doing, you can understand her pursuit. She did say that she has now moved from, just practicing medicine or health as it were, to now trying to see ways to amplify whatever it is they're doing. And I want to say, it's just a voice from my own end, that yes, a lot has been said about cooperation, a lot has been said about what we have to do. The question is, do we do research? Yes. Do we do our research that tailors to our needs? Yes. How much more support of government do we get? That I can't tell. But if you ask me from the little I understand, I don't think it's as much as we want it to be. So pretty much in all of the companies I've mentioned, from those from the academia, from those who are the practitioners themselves, stakeholders from the private sectors, those from the NGOs, you understand that there's a lot that's been done, but maybe just government isn't doing just well enough, to make sure that our pursuit of ensuring to improve lives of people, our citizens, is not well done. So government is up to you to see that we can do that. Then in the areas of communication, I think we are doing a lot, but we are not doing much. You can report it, you can do news, but how many of us pick up a newspaper to say, I want to see something on scientific communication? How many of us in this hall say, okay, let me look up there's a particular place in the media, print media specifically, that talks about scientific communication. We hardly see that. And some of the things that we can begin to talk about so that people will be much more aware. We have that literacy to say that, oh, this is happening, and they can support. Much of the things we see is about politics, is about social events, social political problems, and what have you. Infrastructures these days are beginning to come up, but we don't see much of that in education. But in education, what are the things that we need to do? So these are some of the things I think that we can also look at that to improve that area. All right, for questions, I know people from the audience have one or two to say concerning the first session, and that the first session we had, and this one that just gone by. So if you have questions, let us know. Just tell us where you're from, your name, and then we have your questions, and we have people to answer the questions here. So who wants to go first? Maybe I should start calling names, because I know people to call really. Do we have questions at all? Okay, you are telling us that you are satisfied with whatever it is you've given us comments. Interesting, that's fine. Alright, I've just been informed we're having a short interlude before we take the first break, and we shall reconvene, for the second part of today's lineup of activities. There's so much to say about. We understand that we'll be discussing much later smart cities and inclusive urban transformation. The panelists, we understand, are also very much in the house, but at this time, we will make welcome students from the Department of Creative Arts, led by Dr. Sheikende, an ethnomusicologist, to do a performance, a short performance. A round of applause for them as we go here.
Thank you.
That was a fantastic performance by students of music from the Department of Creative Arts. A round of applause once again for them. Of course, that particular group is led by Dr. Sheyi Kenyine, an ethnomusicologist in that department. All right, I've been made, I've just been told rather by the director of the Institute for International Relations, Partnership and Prospects that we have come to the end of this very session. That's the first part of the program's lineup for today's event. At about 2 o'clock, we're expected to reconvene for the second part of the day, and we'll be taking a look at another important topic that talks around smart cities and inclusive urban transformation. A lot is happening in Nigeria at this time, and then we have the keynote address to be delivered by Princess Adejoke Orelupe Adefidure, Senior Special Assistant to the President on Sustainable Development Goals and former Deputy Governor of Lagos State to Governor Raji Fashola, who will be here to tell us more on what we need to understand around smart cities and inclusive urban transformation. I'm sure you don't want to miss that, so we'll implore all of you to find your way down to the entire area of work at about 2 o'clock, top of the hour, where we shall be taking a look at some of these issues. Thank you for being a part of this. My name is Adebayo Salau, and I'm looking forward to having you here again soon. Thank you very much.
Stop your recording.